Colleagues, I rise to present Senate Resolution number 41, which calls upon the United States Senate to carefully consider the full impact of any measures that amend, revise, or reveal provisions of the Affordable Care Act. SR 41 asks the Senate to ensure adequate public review and input from healthcare providers, consumers, as well as other stakeholders, to ensure that the Congressional Budget Office, the CBO, has provided estimates of the impact of the final bill version, and that the bill be in print and available to the public for at least 72 hours before any vote is taken. Senate Resolution 41 also calls attention to the fact that the House passed the so-called American Health Care Act would, according to the CBO, result in 14 million more uninsured people nationally in the first year alone. Now, let that sink in, colleagues. Shh. By next year, 14 million Americans will lose their health care coverage. And that number rises steadily over the next decade to 23 million people. And if that's not despicable enough, those Americans lucky enough to have their coverage will see astronomical price increases, especially older Americans. In fact, Senate Resolution number 41 acknowledges the fact that the AHCA, the Trump-Ryan Health Care Act, would effectively impose an age tax by dramatically increased premiums and reducing tax credits for elderly Americans. According to the CBO analysis, older, low-income Americans between the ages of 55 and 64 could see premium increases of over 800%. That's not a typo. As it currently stands, the American Health Care Act also opens a door for discrimination based on pre-existing conditions, making insurance unavailable or unaffordable for people with cancer, diabetes, mental illness, or countless other conditions. This was among the most popular nonpartisan provisions in the ACA. Americans overwhelmingly want to keep it, no doubt, but it's effectively gone under the latest draft of the bill. We have to be honest with ourselves about what this bill could mean for California.
Shh. Colleagues?
Again, we have to be honest with ourselves about what this means for California. The AHCA, or the Trump-Ryan Health Care Act, would devastate our Medi-Cal program, potentially costing our state budget tens of billions of dollars and making it impossible to keep up with the demand for care. It will also jeopardize the historic progress California has made in reducing our uninsured population. The fact is, like it or not, under the ACA, or known as the Obamacare, we cut our uninsured rate in half in just a few short years. California's uninsured rate has never been as low as it is today in the history of our state. And yet, as we speak, there are secret negotiations going on at this very moment in the U.S. Senate that can undo all of that progress. It's simply unacceptable for Republicans in Congress to reshape 1/6 of the United States economy, potentially threatening millions of lives without a single public hearing. The Senate wants to pass their measure in the next 2 weeks, and nobody outside of the 13-member Senate working group, not even the chair of the Senate Finance Committee, has even seen bill language. This is not the way democracy works, especially when the stakes are so high for so many. I want to put this in perspective for my colleagues on the other side of the aisle, who have said on many occasions that the process to pass the Affordable Care Act in 2009 and in 2010 wasn't open or transparent enough. Over the course of more than a year, the United States Senate Finance Committee and the Health, Education, Labor, and Pensions Committee held a combined 100 public hearings on health care reform, posted the draft legislation online 6 days before the vote, and ultimately accepted 147 Republican amendments. The House of Representatives held at least 79 bipartisan hearings and markups, and they accepted at least 30 Republican amendments and posted the final bill online 72 hours before voting on it. They did all of that to expand access to health care and make truly historic reforms, like protecting Americans with pre-existing conditions that remain overwhelmingly popular today with Democrats and Republicans alike. This Congress hasn't even held a single public hearing, and they plan to take away coverage from millions of Americans, Democrats and Republicans alike. Think about that. Senate Resolution 41 calls on the U.S. Senate to give Americans a chance to weigh in, because this is a life and death issue, and our health is much too important to be the subject of shady backroom deal making. This is a resolution that's bipartisan nature. This is a Democratic and Republican resolution, and we should, in a unified manner, send a very clear message that the Americans' lives are not up to the highest bidder when it comes to our health care. Let's stand together, colleagues, Democrats and Republicans alike, and send a very clear message to Mitch McConnell and Paul Ryan and President Trump. With that, I respectfully ask for an aye vote.